topic of our presentation is the effects of dietary nitrates and nitrites on lowering blood pressure. My name is Brooke McCollum.
My name's Samantha Warsh.
And my name's Allissa McPhail.
Hypertension is a very common disorder. It affects approximately 74 million adults in the United States. This translates into 1 in 3 adults. In 2005, more than 57,000 people in the U.S. died as a direct result of hypertension. In 2005, 319,000 deaths were either directly due to hypertension or were a contributing factor. Hispanics and Latinos have the lowest prevalence among ethnic groups, while African Americans have the highest prevalence. Hypertension amounted to $400 billion in direct and indirect costs in 2009. There are many risk factors for developing hypertension. These include age, men over 45 and women over 55. Prevalence increases with age. Being overweight or obese, having excessive alcohol consumption or sodium consumption, lack of physical activity and exercise, and smoking. Treatments for hypertension include the DASH diet, which increases fruit and vegetable intake, low-fat or non-fat dairy and whole grains, and it has reduced amounts of fats, red meats, sweets, and sugared beverages. Weight loss is encouraged so that the individual has a BMI between 18.5 and 24.9. Alcohol restriction is recommended. Increased potassium, calcium, and magnesium are also recommended. Physical activity of aerobic exercise for a minimum of 4 days per week for 30 to 60 minutes, and also quitting smoking. Medications can be used to lower blood pressure. Diuretics can be used to decrease blood volume by urinary output. ACE inhibitors block conversion of angiotensin 1 to angiotensin 2, resulting in vasodilation. Beta-1 blockers block beta receptors in the heart to decrease rate and cardiac output. There are many other kinds of medications that have blood pressure lowering effects. Hypertension increases risk for many things, including stroke, heart disease, myocardial infarction, and chronic kidney disease, just to name a few. Nitrate was first made in its pure form by Carl Wilhelm Scheele. Nitrate was used in fertilizers during the agricultural revolution. Originally, amyl nitrite, which is an organic nitrite, was used to lower blood pressure in the 1860s and was replaced by nitroglycerin. Nitrate occurs naturally in many fruits and vegetables. Some examples of vegetables include celery, lettuce, and spinach. Fruit examples include bananas and oranges. Nitrate occurs naturally in soil, natural waters, and plant and animal tissues. Nitrates and nitrites are very different from each other and have many different medical uses. Organic nitrates and nitrites are commonly used in medications such as amyl nitrites, which are used to treat chest pain, and ethyl nitrite is used as a diuretic. Inorganic nitrates and nitrites are commonly found in foods. This is what we are focusing on during our presentation. Inorganic nitrates and nitrites are used to inhibit platelet aggregation, blood pressure control, enhance gastric mucosal defense mechanisms, and reduce oxygen cost of exercise. Both nitrate and nitrite are converted to nitric oxide. This occurs from oral commensal bacteria and also mammalian enzymes. Nitrates enter the body from consuming fruits and vegetables. 50% of nitric oxide is consumed as dietary nitrate and nitrite. When nitric oxide is formed, then this has a blood pressure lowering effect. As you can see in the picture, dietary nitrate and dietary nitrite both end up as nitric oxide. Nitrate first converts to nitrite and then nitric oxide. Nitrite is converted directly from nitrite to nitric oxide. This is another drawing that shows the nitrate-nitrite cycle. Nitrate and nitrite are consumed from food. Bacteria in the mouth reduces nitrate to nitrite. This can also occur from mammalian enzymes. Then a conversion of nitrite to nitric oxide occurs. Nitric oxide in the body is from both food and also from systemic nitric oxide production.
Estimated usage of nitrates, either organic or inorganic,
are influenced by many factors. Differences in intake may be related to culture and dietary practices, levels of nitrates and nitrites in drinking water, and use of certain medications. This combination of factors makes assessment difficult. Toxic levels of nitrates and nitrites remain somewhat unclear. Some negative implications of nitrate and nitrite toxicity are listed here. Keep in mind that high enough levels of nitrates and/or nitrites are relatively uncommon in healthy populations and even less often are the result of dietary consumption. The most common way to reach toxic levels of plasma nitrates and nitrites is through multiple consumption routes. Men over 50 are often at higher risk for this dangerously low blood pressure status as they are commonly on amyl nitrates for cardiovascular disease, may also be taking specific vasodilators such as Viagra, and may then have a high dietary nitrate and nitrite intake if they are on a specific diet such as the DASH diet. This first study investigated the etiology of the Japanese traditional diet's success of lowering blood pressure. The traditional Japanese diet, like the DASH diet, focuses on consumption of a variety of fruits and vegetables, many which are rich sources of inorganic nitrate and nitrite. The study was a randomized crossover with 25 participants, 10 of which were male and 15 of which were female, between the ages of 26 and 46 with normal health status. 2 dietary intervention periods were explored. A control diet of low oral nitrate content with consistent macronutrient ratios among participants was compared to a traditional Japanese diet in which participants lived and ate with parents or grandparents that strictly ate foods such as takai, spinach, burdock, garland chrysanthemum, Chinese cabbage, and certain types of mushrooms. Results from the study show that the difference in oral nitrate consumption greatly varies. A 70-kilogram adult would be consuming 1,316 milligrams of nitrate on the Japanese traditional diet as compared to 259 milligrams, which is the current acceptable daily intake for nitrate. As you can see from the chart, both salivary and plasma nitrate and nitrite increased greatly at the end of 10 days on the Japanese traditional diet. A 4.5 millimeter of mercury diastolic blood pressure decrease was seen with the Japanese traditional diet with a p-value of 0.0066. In conclusion, this study found a positive correlation between the Japanese traditional diet consumption and lower blood pressures. We gave this study a grade of A-. Although well designed, this study was still small and the model needs to be replicated. Another study published in 2010 gave more insight into the effects of dietary nitrates on blood pressure, and also how the effects may be different for men and women. The study was a randomized crossover study with 3 different study groups. Potassium nitrate capsules of 4 and 12 millimoles were compared in 6 participants. Potassium nitrate was compared to a potassium chloride control with 12 participants. And beet juice intake, which is very rich in organic nitrate, was compared in the same amount to water in 9 participants. Blood pressures of the participants were measured at baseline and then at the end of the study period. Graphs A and B, which are on top, show a significant lowering in systolic and diastolic blood pressure when taking potassium nitrate rather than potassium chloride. Graphs C and D, which are below, show that the amount of potassium nitrate supplement given also positively contributes to the blood pressure lowering effects of nitrate supplementation. Systolic blood pressure seems to be more drastically affected in this example than diastolic blood pressure. Initial results of this study showed that plasma nitrite concentration had a much stronger correlation to decreases in blood pressure than plasma nitrate concentrations. This study concluded that nitrate supplementation or vegetable intake from beetroot juice may result in rise in plasma nitrite and cyclic guanosine monophosphate, which is an activator of vasodilation and controls of vascular muscle tone. Depending on the dose, both of these treatments may lead to decreases in blood pressure. Analysis of the data showed greater effectiveness in male volunteers than female volunteers. Overall, we give this study a grade of A-. It is another well-designed crossover study, but replication is needed to improve the supporting evidence.
A third study done in 2008 aimed to measure whether or not the use of antibacterial mouthwash would diminish the commensal bacteria's ability to convert a dietary load of nitrate into nitrite and then to nitric oxide, therefore defeating the supposed blood pressure lowering ability of dietary nitrates and nitrites. The study was conducted by having two separate experiments in which there were 7 participants. The first experiment was the control, in which a 5 milliliter sample of blood was drawn both 30 minutes before and again immediately before ingestion of a sodium nitrate solution. In the second experiment, the same procedure was done, except with the participants gargling 10 milliliters of mouthwash 15 minutes before ingestion of the sodium nitrate. In both experiments, saliva and plasma samples were taken at 15-minute intervals after ingestion of the sodium nitrate. At the conclusion of the study, it was found that although about 80% of commensal bacteria were destroyed by the mouthwash, there was still a rise in plasma nitrite after a dietary load of nitrate. The exact mechanism for this has not been found. We gave this study a grade of A- because it was a very well-designed crossover study, but it had a very small number of participants. Because of this, more studies of a similar design would need to be done in order to justify the results. Some recommendations we found regarding the use of dietary nitrates include one from the Food and Agricultural Organization and the World Health Organization, which sets the acceptable daily intake of 0 to 3.7 milligrams per kilogram of body weight, which is about, on average, 222 milligrams of nitrate. The DASH diet has also set some recommendations. The high nitrate DASH diet recommends about 222 milligrams per day, and the low nitrate DASH diet recommends about 174 milligrams. The FDA has not set a DRI for nitrates or nitrites thus far. We give the overall level of evidence supporting the use of dietary nitrates and nitrites to lower blood pressure a 2, meaning that the supporting data is fair. This is largely due to the fact that although many well-written and designed studies have been done on the topic, many have an inadequate sample size, which calls for more studies done on a larger sample of participants. Our public health recommendation is as follows. Eating vegetables and fruits that are rich in nitrates and nitrites may lower blood pressure. There are a few points not addressed in our public health recommendation. One is that the frequent use of antibacterial mouthwashes may reduce the possible benefits of the nitrates and nitrites, as well as the fact that males may see greater results from less amounts of nitrates and nitrites than females. After all of our research, some questions still remain unanswered. Mainly the question of whether or not the blood pressure lowering effects are due to the nitrates, nitrites, and nitric oxide themselves, or are they due to the antioxidants, vitamins, polyphenols, and high potassium count of the fruits and vegetables that are consumed? The answer to this question can only be found through further research.